Hello, everyone. My name is Araceli Marquez, Certified Health Education Specialist. Today, I will be presenting on the impact of COVID-19 on the mental health of vulnerable populations. I will begin with a brief overview and introduction, then I will move forward to identify the vulnerable populations, the interventions and strategies approach to address this issue, and the future directions. Mental health is vital for individuals to be able to lead fulfilling lives. In addition to physical and mental health involves an individual's social and emotional well-being. It is not simply health without disease or illness, according to the World Health Organization. Various factors have disrupted the lives of adults during COVID-19 that could be impacting mental health, including stress and worry of contracting the virus, isolation, grief, and loss. Their situation worsened for some who were already suffering from mental health illness before COVID-19. During COVID-19, 4 in 10 U.S. adults have reported symptoms of anxiety or depression, according to the Household Pulse survey conducted in January 2021. The Kaiser Family Foundation Health Tracking Poll from July 2020 demonstrated how the worry and stress over COVID-19 impacted adults' mental health and well-being, with 36% reporting difficulty sleeping, 32% difficulty eating, 12% report an increase in alcohol consumption or substance abuse, and 12% worsening chronic conditions. Similar trends in Los Angeles County were also experiencing a surge in demand for mental health services. The county has received around 4,000 calls per week in April, a 25% increase from April 2019. Some populations were at a higher risk of experiencing adverse mental health during COVID-19. The future is uncertain for many essential workers, including their increased risk of contracting COVID-19. It was found that essential workers reported symptoms of anxiety or depression more frequently when compared to non-essential workers, 42% versus 30%, and in increased substance use, 25% versus 11%, and thoughts of suicide more regularly than non-essential workers, 22% versus 8%. In the case of healthcare workers, addressing psychological issues should be a priority because it can lead to burnout, decreased work performance, or affect employment opportunities. In the US, key findings show that the pandemic has disproportionately affected communities of color. Key results show that non-Hispanic Black adults and Hispanic or Latino adults, 46% in contrast, report more symptoms of anxiety or depression. The populations at higher risk for mental health issues include the elderly population. Epidemiological research shows that mental health disorders are over 20% common among older adults 60 years and older worldwide. Implementation of strategies and interventions is an approach to address the mental health and well-being of healthcare workers. Studies have found that self-coping strategies during epidemics are helpful to healthcare workers. In a survey of 657 American healthcare workers, 59% responded that exercise was the most used coping strategy, and 33% indicated that self-guided online counseling was most effective for them. Psychosocial interventions are recommendations by studies aimed predominantly towards stress and fear to assist healthcare workers. Various studies in previous epidemics identified a need for more significant support through collaboration, training, and education. Further, hospital support systems and occupational health policies can promote healthcare workers' psychological well-being. In response to future infectious disease outbreaks, a better understanding of employee fears and factors that contribute to those fears will be beneficial. Healthcare workers are likely to face several types of mental health risks, so further research is necessary to identify the underlying mechanisms that could, with appropriate measures, help mitigate these risks. Despite the psychological strain of working in the frontline, participants' narratives show that sharing experiences and close connections with colleagues diminish psychological distress. Suggestions to ensure that professionals are provided with protected time to have the opportunity to reflect and recover during working hours. To provide better employee support, organizations should build and strengthen their internal support networks by providing peer support, psychological counseling, or a 24/7 professional hotline. It is also imperative to promote informal support, for example, between colleagues, and organize moments to facilitate it, for example, moments to allow for quiet reflection or activities to enhance relationships among colleagues. I work for a healthcare organization in a non-clinical department. As a response to the various aspects of COVID-19, our healthcare organization hired professionals to lead monthly grief support groups and weekly mindfulness meditation that is offered virtually every Tuesday for 15 minutes. Our department has participated and feels that it has positively impacted our mood and overall work performance. However, I think it offers limitations to the clinical staff who have a far more hectic schedule. Mindfulness meditation should be delivered on different days of the week and provided at other times, accommodating more healthcare workers. To address the mental health issues encountered by communities of color, implementing strategies and interventions is necessary. In Orange County, California, Latino communities participated in a study to determine the part that promotores de salud, also recognized as community health workers, play in integrated mental health care and social services to respond to the COVID-19 pandemic. The participants were part of the Latino Health Access Bienestar Emotional Wellness Program, addresses an array of needs for the community that involves three distinct ways. The first is through narrative therapy and peer support, then by overcoming barriers to healthcare and addressing immediate social needs such as food and housing insecurity and health needs, and by developing community advocacy and leadership for social and health equity. As a result of its reach, human-centered design, and trust-based relationships with community members and program facilitators, Promotores de Salud is the ideal vehicle for providing integrated care for following COVID-19's implementation in March 2020. Upon enrollment, promotores assisted participants in identifying their most pressing social needs and discussing the critical issues. To ensure that mental health is treated equitably during the pandemic, there had to be an account for social needs and the increased stress caused by the pandemic. Based on personal work experience in Los Angeles County, I advocate that promotores de salud effectively integrate mental health and social needs. They played a significant role in addressing vaccine hesitancy and community outreach. We participated in a few COVID-19 vaccination clinics alongside promotores de salud. Since communities trust them, they went knocking door to door and provided information on COVID-19 vaccines and informed them of the mobile vaccination site if they remained unvaccinated. They receive ample training to be able to perform community outreach. We also work closely with promotores de salud from the LA County Department of Mental Health, who are actively involved in the community. They address other social needs that could potentially affect mental health. Suggestion strategies to approach the psychological and mental health of the elderly during COVID-19 include problem focus and emotion focus. Recommended strategies include psychological health, social health, and physical health. Psychological methods include avoiding reading, watching, or listening to news stories about the pandemic, leading to continued stress and anxiety. It is also essential to understand the fact that it is natural to feel stressed or afraid when unforeseeable events occur, providing attention to one's needs, emotions, and thoughts, and to not discriminate against or blame anyone or any group for the infection. So, social health strategies involve maintaining contact with family and friends, keeping regular religious activities, and contacting the local community, as well as improving cognitive and emotional functions, maintaining social networks, and improving elderly quality of life. Physical activity plays an essential role in improving mental health and well-being. As a program coordinator for the Senior Wellness Program Viva Bien, Live Well, I am aware of some of the challenges encountered by the seniors during COVID-19. At the pandemic start, we had to pause the program. I conducted phone surveys to identify some of the current challenges and barriers the members encountered and figure out how we could best assist them or meet their needs. The members expressed how much they miss their daily activities and interactions with family and friends. Many conveyed feelings of anxiety, isolation, and depression. Additionally, some were interested in receiving emotional support, mental health resources, and assistance with social needs. I provided mental health referrals for some of our members by connecting them with partner organizations. Many of our members shared strategies that included psychological, social, and physical health to cope during COVID-19, such as exercise, gardening, knitting, dancing, reading, word find sheets, and crossword puzzles. After conducting these surveys, I redesigned the program during the pandemic, and the best approach was to provide classes over the phone like conference calls. A promotora from the LA County Department of Mental Health would provide classes via the phone to identify resources needed by the seniors and provide referrals. A pandemic can generate emotional contagion, for example, the spread of mood by inducing emotions directly through a population. On a national and international level, stakeholders must prepare for this emotional contagion. Mental health policy should be integrated into pandemic preparedness in the event of future pandemics and use a conceptual framework for mental health preparedness and action. The pandemic's early phase should focus on preparing infrastructure, for instance, mental health surveillance system, training volunteers and healthcare professionals, and creating materials to supplement the mental health personal protective equipment. Data from an mental health surveillance system are collected, analyzed, interpreted, and distributed to those responsible for epidemic prevention and control on time. To enhance the country's preparedness and response to a pandemic, funds are essential. The inadequacy of mental health resources will impact the ability to alleviate the effects of a surge in mental health related problems. Organizations like World Health Organization, CDC, and departments of public health and mental health are key stakeholders to promote and advocate for mental health preparedness and action changes. To conclude, it is crucial to prioritize the most vulnerable populations and communities during a pandemic and improve mental health preparation and coordination. To reiterate, social needs need to be addressed for a pandemic's impact to be mitigated on the well-being and mental health of the population. Mental health should be a priority, and raising mental health awareness is necessary, not only during the times of a pandemic, but overall because it influences how we think, feel, and act. It also helps us identify how we manage stress, relate to others, and make healthy choices. Additionally, adequate funding should go towards mental health services and the allocation of resources. Thank you.